This video will focus on return to work guidelines. The information has been provided by the Ontario Neurotrauma Foundation's best practice guidelines for concussions and mild traumatic brain injuries. Returning to work and activities after a concussion or mild traumatic brain injury can be a challenge due to the various impairments that occur as a result of the injury. It is suggested that a gradual resumption of regular pre-injury activities occur as tolerated, for example in a manner that does not result in exacerbation of symptoms, within the first few days to weeks post-injury, as activity is more likely to speed up recovery rather than delay it. To facilitate this process, healthcare professionals should advise patients on appropriate restrictions and limitations, and then focus on their abilities to ensure an optimal plan to return to work. For example, when to return and the load of work they should begin with. While a short period of physical or cognitive rest may be beneficial, complete bed rest in excess of 3 days should be avoided. However, activities with high concussion or mild traumatic brain injury risk should be avoided in the first 7 to 10 days. It is important to consider both physical and cognitive activities when advising patients on their return to activity to mitigate the potential of exacerbating symptoms. Cognitive load refers to mental activities requiring attention, concentration, and problem solving. Examples of activities that can be associated with high cognitive load include tasks requiring sustained concentration, attention, or problem solving, reading, computer or cell phone use, and demanding social interactions. Should symptom exacerbation occur, patients should be advised to temporarily reduce their physical and cognitive demands and resume activities at a slower pace. It is suggested that the majority of workers with these injuries return to work within 1 to 2 weeks. Predictors for return to work extend beyond injury severity and medical comorbidities, with the following factors having a strong influence on disability duration: recovery expectations, advice of the healthcare providers, and socioeconomic factors. It is important to avoid medically unnecessary delays in a patient's return to work, as employment is an important factor of health. To facilitate a timely and effective return to work for patients, healthcare providers should use a structured approach to assess fitness for duty while being mindful of factors that can influence the outcomes of an individual's return to work. An extensive list of these factors can be found below this video. A stepwise approach to return to work planning for patients is as follows. The healthcare professional should identify medical restrictions, limitations, and document symptom triggers. The employer should review this information as well as the demands of the job and identify opportunities for accommodations. Together, the employer and workers should formulate a return to work plan. The goal of any return to work plan is to enable the worker to fully participate in tasks while staying below the threshold for symptom exacerbation. There is no common template for return to work that fits the needs of all individuals in every circumstance. As such, each program should be prescribed on an individual basis and should aim to support the reintegration and rehabilitation of the individual back into the workplace. An unsuccessful return to work may have profoundly negative economic and psychosocial consequences on affected individuals. Workers who were employed reported better health status, improved sense of well-being, greater social integration within the community, less usage of health services, and better quality of life in comparison with those who remained unemployed. When persistent symptoms hinder return to employment, educational activities, community roles, and activities promoting community integration may be considered as an alternative focus for meaningful activities. For patients who have not been able to successfully resume work duties following an injury, they should be referred for an interdisciplinary vocational evaluation that includes an assessment of the following: cognitive or psychosocial functioning, occupational and job demands, work environment, environmental supports, and facilitators and barriers to successful return to work. Algorithm 12.1 Return to Work Considerations is available for healthcare practitioners to assist with the determination of readiness for return to work. For further information regarding return to work guidelines, you can refer to Section 12 of the Ontario Neurotrauma Foundation's guidelines for concussions and mild traumatic brain injuries and their persistent symptoms. Special acknowledgements go out to the Kinesiology Department at the University of Waterloo, the Centre for Community, Clinical and Applied Research, and the Ontario Neurotrauma Foundation, which provided the funding for this video.